Hello and happy holidays. Hopefully this finds you, your family, safe and doing well. And I really wanted to thank those people who have supported us, both the people who have joined and been able to explain various different complex topics to our viewers, our listeners, and our patients for their betterment. How to be able to understand the various different things that cause pain, how to be able to treat it, and really how to be able to get your life back and lead the life that you deserve. And this live stream, what we're going to do is kind of recapitulate and talk about some of those individuals who we were fortunate enough to have on the channel to come through and talk to us during the year of 2020 and how we can be able to take and put all those things together to be able to have a better 2021. So we're going to reference some of the things that were present in our channel and really be able to utilize that as a mainstay for how to really be able to kind of get a jump and a leap to get off to having a good 2021 year. So as we take a look at our channel, some of the things that we see is the various different commentary and discussions with individuals about a whole host of different things. And we're going to talk everything from bionics to spinal stenosis with repairs from Vertiflex to regenerative medicine to different ways to be able to treat different elements of how to be able to improve one's pain. And initially what we're going to start with is with a quick review from Dr. Carla Hightower, who talked about nutrition and inflammation and how to really be able to modify our diet. As we're looking at this aspect of 2020 and people start making resolutions and say, you know what, I'm going to eat better, I'm going to do better, I'm going to be better, then one of the things that we really need to think about is, can we do that within the context of being able to eat to control not only our overall preventative health, but also ways to be able to reduce pain by looking at inflammatory status. So we're going to give a quick little snippet from this video where she references different things that can be done as well as a resource for us to look after, and that may be able to provide good value. So let's take a quick listen to Dr. Carla Hightower when we were fortunate enough to have her join our channel.
Oh yes, and I think this is really a great way for people to get started, is to look at some of the documentaries that are evidence-based. Forks Over Knives really ties in the China study and that research that was done decades ago and really proved that we can make some significant, I would say simple, but powerful changes in our diet and nutrition and get these kinds of results, that we can see the connection between what we're eating and how it affects our blood vessels, how it changes our risk for chronic problems like diabetes, heart disease, and certain cancers are even connected to food. So I think that starting with a documentary like Forks Over Knives is a great idea. It's available on different platforms that you can watch, and gives kind of just a beautiful overview where you see the stories of people who've made this change in the way that they're eating. And it's inspiring. And so I think it's a great place because we've got to see where we want to go. If you've never seen anyone make change, never seen anyone reverse their heart disease, you may not think it's possible. But videos like that show you can absolutely cut down that inflammation and start reducing some of these symptoms yourself without really anyone prescribing something, that you can do a lot for yourself.
So with that, you can do a lot for yourself. Watching that video, understanding what it is Dr. Hightower is talking about, and maybe even connecting. She's a CEO of Living Health Works. It's actually connected in the link. If you're interested, we can put it in a link to this video as well so that you can be able to seek her out, be able to pursue a natural course of how to be able to be healthier. How can you find a way where it's not reliant upon injection, surgery, or post? That's one of the starting points that we really want to talk about when we look at an integrative process. One of the other commentaries that we really want to kind of get into is, can we be able to look at some local resources to the Michiana area? And one of those resources is Nicole Dyer. She is actually the founder and owner of CryoEdge Elite Performance. which she's going to talk a little bit more about cryotherapy and give insight. And we're really going to reference this video so people can have an understanding and a synopsis of some things that they may have missed.
So with kind of getting to that same element, if you could have a billboard that you'd have on anything, what would it be and why?
You asked me that, and I had to write this one down because I had to think about it. I actually didn't have to think about it long, but I want to say it correctly. So, my billboard wouldn't have anything to do with the cryo part. It would say, "You don't have to move mountains. Simply fall in love with life and yourself. Be a tornado of happiness, gratitude, and acceptance, and you will change the world just by being a warm, kind-hearted human being."
Okay, so that is very much a value statement of
That's
where
good.
you're coming from and how you kind of approach the world.
Mhm.
Noted. All right. So, what are some things that people probably misunderstand about cryotherapy? Can you be able to dispel some misunderstandings?
The biggest misunderstanding is probably the fact that people don't like the cold and they feel that being in the cold makes them hurt. Just like in the winter, we have that damp, wet cold, and it does. It makes people's bones ache. This doesn't do that. It's a very dry cold, and so like I said, it doesn't go bone deep. It doesn't go core deep. So it's really not as cold as what people think. So that's probably the biggest misnomer. And the other thing is just educating people on all of the different benefits that it does have. Even when I first started this, it was really out there for athletes, and everybody thought that it was only good for athletes. But me being so broken and having many other people that have come to me that just have injuries or health issues, I think it's just as beneficial, if not more beneficial for people like me and others that are just hurting and want some type of pain management without having to take a pill for this or a shot for that. I used to have to get injections in my neck regularly, in my knees, and I was taking all kinds of different medications, and that's when I said enough's enough. And I'm pleased to say that I have, since I've started my nutrition classes and my coaching classes and all the different things that I've done, and with this and the bioenergetics, I have been completely medicine-free, shot-free since 2017.
Okay. So again, being able to speak from someone's why, them having that own experience of having the challenges has been a motivating experience for many of our guests. And we were lucky to be able to really get so many good individuals that not only spoke about how they could be able to help people, but also spoke from their heart on how it impacted them personally and how they can be able to identify with those people that they treat. So when we talk about finding individuals that can be able to give a reason and story for how they got to where they were, one of the most really unique stories comes from the founder and CEO of Incrediware, who really just has a really interesting and kind of significant story for how it came about for him developing this product.
So I was up on the bike. It was mountain biking. I was fully geared up, and I was riding along. And we have this saying in all of sports that's kind of, it's an axiom of how you should live. Do not look where you don't want to go. And it's kind of same in medicine. It's kind of same in almost anything you do. If there's a tree there, don't look at the tree because it'll make you gravitate towards it. And so here I keep on telling myself, okay, don't look where you don't want to go. And all of a sudden, there's a lava rock sitting in the middle of a trail on a cliff going the bike trail going down really steep. And so I'm like, okay, don't look where you want. And then all of a sudden I looked at it, and that little pause made my front wheel lock on that lava rock, which didn't move. It was actually part of the lava. And I actually flipped and turned. And as I'm going through the air and saying some nasty words, I was thinking, there goes my bike. I was thinking about my bike first. And so when I landed on rock, and I thought I broke my wrist because the rock got me was on it's kind of like when you get injured, in a car accident. It's only when you hit and stop that you get injured, and I'm thinking, okay, gotta roll. You can't roll when you hit rock. And one of the rocks happened to stop me from going another 25 feet, and I hit my right hip. And I was just thinking, oh man, wow, broken wrist, that's okay. It's okay, I can ride out, because I was by myself and it was dark. So I had to ride another 7 miles, and I'm riding out, and I'm thinking, man, I'm gonna down one. There's no way, this is embarrassing. And so,
Wait a minute, hold on a minute. You had 7 more miles to go?
and it was really spooky, because it was steep. And so anyway, I get down to my house, and the adrenaline is kind of like being in any accident. Like some people actually, their adrenaline gets so high they can lift up a car or whatever. Well, I made it down. Not only did I make it down, but I woke up the next morning and I had told my buddies I would go on the same ride. And I did the same ride again, but I couldn't stand up. I was actually bent over. And the guys are going, what the hell? Why can't you stand up? I said, I'm okay on the bike. It's okay. It's okay. I'm good. And I'll take the lead. So I took the lead and I made sure that I walked past the cliff area because it was the same ride again. And then I made it down. And that day, this is the male thing. I'm doing work around the house. I'm thinking, man, I'm standing up straight. So I thought, I'm going to go for a 10-mile night run tonight. So I put a headlamp on. I put my waist lamp on. My hips hurt a little bit. And I'm like, okay, here I go. So I'm running. And 5 miles into the run, my foot starts going, just dropping. Total foot drop. No control. And so I get back to my house and I shower off. And I'm like, oh, I can't feel my leg. Oh, my God, this is weird. Zero. I couldn't feel anything. You could put needles in it, knives in it. And so that was it. The next morning I woke up and I took one step, and that was it. That was the last step I had taken without help for 4 months. I had herniated one vertebrae, L4 to L3, 22 millimeters out of the spinal cord and back up the spine to L3. And it was pinching several nerves. But most of my pain was in my hip and down, numbness in the leg, and not a lot of back. So I thought, man, I'm gonna go in for an MRI of my hip. My buddies, or they own the MRI center. So I go in there and they said, oh yeah, you have trochanteric bursitis, really bad. It looks like that thing got smushed. But there's something going on in L5 and L4. I don't know what it is. So they redid the MRI and they went, oh my God, you got 4 severe herniated discs. The one's really bad. We need to get you in. I'm crawling in to the neurosurgeon, which was a mistake because it was my buddy. And I went in there, I'm laying on the ground and was like, I can't get up. And they're like, I think you herniated the disc in your neck too. And I think the problem's in your neck, not your low back. And I'm like, look at that. There's the nerve's 90% pinched. And so she said, come back in a couple weeks. And then I still couldn't walk her wheelchair. Went to another neurosurgeon for the U.S. Olympic team for skiing. And he said, wow, you got denervation of the iliopsoas. And I don't know if we should do surgery on you. You're so messed up. We'd have to fuse your entire spine.
Okay, so as you can tell, quite the story. It does come out to a good outcome, and it actually spurred him to invent a product that is used all over the body for a different type of clothing that promotes healing and blood flow. Is really useful for those individuals that have regenerative medicine, but even for those people that have osteoarthritis and being able to improve their pain. And we've just had a number of guests that have had similar experiences where they have had these life-changing experiences where they've looked towards potentially traditional medicine and have said, could I potentially pursue another alternative? Our next speaker that we had on is a regenerative medicine specialist and is one of my favorite guests because not only is he incredibly skilled, he's also incredibly personable and can really be able to relate to patients and give them an experience that they understand what's going on, why we're doing this, and why they need this potential option as opposed to another traditional one. Stay tuned.
I explain it to my patients. It's the use of natural healing, basically. We all have the ability to self-repair. The definition of life is self-repair. As long as you're living and breathing and blood is running through your vessels, you're going to self-repair, right? if you cut yourself and bleed, it will take care of itself. We're just going to take those same cells, channel your body's energies and abilities in the right direction with those platelets or stem cells to get repair of tissue, and in some cases, regrowth of tissue. And so in my practice, as you mentioned, I am PM&R with a fellowship in sports medicine. So the bent is on strains and sprains and bumps and bruises and things like that. Again, accurate diagnosis of the condition, and then injection of your cells, either stem cells or platelets, into that tissue, precisely placed via guidance, either ultrasound guidance or fluoroscopically guided, into that tissue, and allowing the body to do what the body does. The body self-repairs. As long as we do the right things, avoiding ice, avoiding anti-inflammatories, and employing relative rest during the healing period, we should have good repair. And we have great success in doing so, as you very well know.
Okay, so with this, there's a number of docs that don't have an understanding of regenerative medicine. They just don't. Whether it's primary care doctor, whether it's orthopedic doctors, whether it's anesthesiologists, podiatrists even, right? And sometimes we have these misconceptions that because we don't experience it, it can't possibly be true. I know I've spoken to docs at one point in time, a number of years back, and they're like, regenerative medicine is nothing but hogwash. It's people selling snake oil. You give us an understanding, so if those patients are conflicted, they can hear about this from multiple different sources. How can we be able to get an understanding about what's true and what's not?
Well,
Okay, so to reiterate that, because the volume wasn't always the best in some of our early videos, and I do appreciate those of you supporting us, even when we're trying to work with technical difficulties and find ways to get better to be able to support you. The question was asked, so how do patients really understand regenerative medicine, particularly when they know their docs sometimes say, I don't believe in it. I think it's hogwash. I can't really understand what that actually is. Can you give me a better way to be able to ascertain exactly what regenerative medicine is when our doctors don't give us a good clarity of understanding? And then we're going to address a question from one of our live stream members who's asking about what do we do if back surgery fails. So stay tuned to Dr. Jackson's response.
I always tell them to go to the internet. There's a ton of information. You can Google, do a Medline search if you choose, and look at the research. The research has been very good. Regenetics, we do a ton of research that has proven that we can self-repair. And so when I hear that, which I hear often, I ask people, if you cut yourself and bleed, do you heal? Because I hear it all the time. Well, my surgeon said that doesn't work. That's poppycock, and you're selling snake oil. Not true. I have before and after pictures to prove it if you want to see them. But most importantly, if you have the ability to self-repair, those cells aren't going to turn themselves off when we place them in damaged tissue. And so once I explain it in layman's terms, because it's really pretty simple, I start off with a 7.5-minute video that they watch before I walk into the room. Just explains natural healing. And once they've seen that, I just kind of build on it. And people understand it by the time they walk out. Because it's common sense. I mean, again, how many times have you cut yourself and bled and it repaired itself? It healed. You don't walk around with tons of scars from your childhood that never healed. So those same cells have the ability to repair the tissue that you've been told may not be amenable repair with stem cells or platelets.
Okay, so just as an aside, we have a bunch of different comments that are coming in. I can't take credit for this, but
Okay, so you kind of got that spiel of regenerative medicine, really how you can be able to do your own research, understand what it actually is. We're going to take a quick break for a quick section that talks about really our channel, what we do, why we're very fortunate to have people join us, and we're so happy that you have supported us this year, and we hope that you will support us in the upcoming year of 2021. Thanks for joining us again. So as we're talking about the different guests and different treatment options that we expose people to in 2020, that we're fortunate to really be able to have not only the support of our viewers and watchers, but the support of the people who joined us to talk about various different topics. One of the topics that we're going to discuss right now is that of Vertiflex, which talks about spinal stenosis. And we had a question previously, what happens or what can you do if surgery for the back fails? I guess it depends on the type of surgery, it depends on the person. But in this particular instance, let's say that you had discectomy, you had a disc surgery that tried to improve that of the back pain. And one of the things that we talk about is maybe it's not back pain, perhaps it's more spinal stenosis. And before we talk about doing a full-blown fusion, maybe we can be able to do something else. Here we have a guest of Callie from Boston Scientific and Vertiflex. Listen into what she has to say.
Us a little bit more in depth and detail about what exactly Vertiflex entails and how it may be able to provide some benefit to patients. Can you tell us a little bit about it?
Definitely, and I think that short video did a great demonstration so patients know what to expect during the procedure. But a little bit more on, why this procedure is out there is for those patients dealing with mechanical pain. So it's dealing with pain from that stenosis, and that stenosis is going to be happening just from the wear and tear on our spine. Like as we age, we're losing disc height. The canal in my little model that you could see right here, this space is narrowing. So it's normal, and that's why we see it in patients, 60 and up. And really what Vertiflex does is it targets this area, right, to lift and relieve pressure off of the nerves. Let's get this implant back in there. Off of the nerves that are being impinged. So like Dr. Landrum said during the video, it really is for patients that have the pain radiating across the back, down through the legs. That's what we're targeting, is by lifting up this space and leaving it open. It's going to mimic the same relief you get when you have a slight bend forward. A lot of patients identify with the shopping cart syndrome. It might cause pain, numbness, tingliness when you're walking or standing for too long. And when you do a slight lean forward, it opens up the space in that canal, and it frees up those nerves. So what we're trying to accomplish with the Vertiflex procedure is give you that permanent feeling of the relief that you get when you have a slight lean forward. And similar to what Dr. Landrum showed with that video, it's done an outpatient procedure. I'd say it's about a 30-minute procedure, and patients are walking out the same day.
Okay, so one of the different treatment options for back pain and sometimes leg pain, if we're being fancy with it, central or neuroforaminal stenosis with neurogenic claudication. But at the end of the day, it's exactly what Callie just said, and that is back pain and sometimes leg pain that can be worse when you stand and you try to stand for a period of time or you walk for a period of time. This type of treatment, same day procedure, get you in, get you out, and that way you're not laid up in the hospital with various different risks that are associated with it. One of the treatment options that we covered when we talked about different things, and we have a couple different videos talking about Vertiflex as one of the options that we have. And if you really are interested in that, by all means, go check it out. On the opposite end of the spectrum, we go back to kind of natural therapies, and one of the best docs in the area of Michiana, Dr. Mark Lindholm, talks about CBD, what it entails, how it's different than marijuana. We're going to kind of segue to that for a little bit and go a different way than the invasiveness, and then we'll come back and we'll talk about some other treatments that also sit within that realm of minimally invasive type treatment options. Let's see what Dr. Lindholm has to say about CBD and some of the things that it may be able to provide as benefit.
And so anyway, it was really difficult because I didn't think I could go on like this, but I really wanted to keep practicing. So kind of out of desperation, I get a lot of journals, and I've been reading a little bit about CBD. But honestly, because I thought it was marijuana, I was just pushing most of those things aside and thought, well, I'll read that later when I have time. But I tried a product out of desperation, and it was amazing. literally within 24 hours, the pain was about 50% better in my wrist. And I continued, it was a topical product that I used originally. And over the course of about a month, I was able to rehabilitate my wrist with I believe, with the aid of the anti-inflammatory effect of the CBD. I think that helped the healing and helped me be able to rehabilitate it. And I have no limitations now. I can do everything I can do.
Okay, so he was talking about CBD as a potential option. Now, not all CBD is created equal. There are different forms and variants of CBD that can be able to provide different amounts of value depending on the source, the strength, what the additives and mixtures thereof happen to be. But really, at the end of the day, what we want people to understand is that you have options. And we want to make sure that patients understand those options that are in place, how you can be able to use this as potentially a resource to say, you know what, I'm open to learning more and more about those options, coming into the aspect of this channel and getting some insight about what those options may happen to be, how it might be personal to me or someone that I love and care about, and how I can be able to utilize those options in order to live my life in a fuller fashion. Okay. So one of the things that we're going to talk about now is one of the videos that I talked about going into the depth of research and what that entailed really when we got down to kind of the nitty gritty of it and understanding that aspect of platelet-rich plasma and how that really makes some degree of impact and what we really can be able to garner from that. So when we got down to it, one of the things that we were hearing repetitively from patients and watchers were that PRP, platelet-rich plasma, when you inject those platelets into the different parts of the body, we're not really sure if it makes an impact. And what we looked at in this particular video was the number of different studies that looked at injection, particularly for back pain, for the facets. And so when we talk about facets, what we're talking about are those areas that are part of that joint area that's present right in here. That's key for mobility, that you can be able to see that area that causes you problems when you bend, when you twist, and when you turn, right? So those areas are like areas that are probably 60% of most back pain, right? And so what we're looking at is how can we be able to treat that, not with steroid, and not with a destructive process, but can we be able to improve that from a differing context?
Regenerative medicine that really references literature, because many times what happens is I will talk to patients about regenerative medicine and their primary care doctor, their secondary doctors, and their surgeons will say, well, the literature doesn't really support it. It's a lot of people that have voodoo, and it really isn't super strong in terms of having an understanding about what's going on with how we base our judgments. To be quite frank with you, a number of orthopedic procedures themselves don't have long-standing historical RCT trials with a control and experiment. What I mean by that is the following: is there's very few humans and people who will say, do a fake spine surgery on me, and I will be part of the research study for that. Just really doesn't happen, and there's some unethical pieces behind it, so it's hard to be able to mimic those type of treatment options. But be that as it may, we will see how we can be able to try to hold ourselves to a higher standard. So when we referring to regenerative medicine, so we take a look. This particular article was present in Pain Physician in 2016, so about 4 years old. By the way, so if you're not a medical personnel, you can still get access to this journal. It's free. You can just Google it, you can find it, and you can go take a look at a whole host of different articles. So this article is a new technique for the treatment of lumbar facet joint syndrome using intra-articular injection with autologous rich plasma. So one of the reasons why I started with all these YouTube references is because I knew people were going to be like, man, that title is daunting. It is like, what the heck does it mean? But as you know, every time we do these live streams, we break it down. So to give you that pitch at Cutting Edge Pain Relief, one of the things that we look at is how can you be able to punch pain in the face, get back to leading the life that you deserve, and we're really going to make sure that you come through and that you understand exactly what I'm talking about.
Okay, so a little hard to visualize in some of the aspects of the graphical representation, but basically we try to cover at least once a month one research paper so that our viewers know that we're not full of baloney. Let's use that reference, all right? So that you know that there's something substantive behind it. We're not just going to give you a whole host of, flimsy topics that have no value and no support behind them. And frequently what is touted is that there's research that's behind, well, let's do this option A, option B, and option C, which are the options that have been used for greater than the last 50 years. And I'm not saying that those options aren't effective, but they're not effective in everyone. So when those options fail, then what do we do? And that's where we really look to fill that niche so people understand that you don't just have to suffer in silence. You don't have to consider, oh, I'm weak and I'm not stoic enough, I'm not tough enough, I'm not able to be able to do these things. But can we look to be able to provide you value that lets you be able to say, this is something that I'm looking to try because I want to be able to have a better life. Our counter to many medical professionals has been, I think they've said, well, are we giving people false hope? And to me, I think so long as you're honest with people, you're honest with viewers, you're honest with patients, and you're telling them this is your percentage of success. So for instance, we're going to talk about a couple other things that only have a 30% success, and placebo effect may be 30%. But when we compare that head to head to potential deleterious or side effects at the same time when we look at the efficaciousness of that potential treatment option, at that point in time, I think it's up to the patient to make an informed decision to say, this is something I'm willing to try, because it's much better than me sitting here and saying, I don't lead a life at all. So in that regard, we're going to talk about some couple other topics to go forward of what else can we be able to have a conversation about. And one of those is the aspect of medical laser. And with this, we're going to talk to Dr. Phil Harrington, who's one of the most renowned experts on laser. But on top of all of that, he also is just truly impassioned about this topic. If you missed this live stream, you missed out. But I could tell you, if you're interested, please leave us some comments below and say you'd love to have Phil back on the show to answer specific questions, because he is a fount of knowledge. He's down to earth, and he has a breadth of exposure and understanding of how to be able to use laser, particularly for painful states. Hey, stay tuned. Watch it.
The reason I am so confident in the future of laser therapy, that it is here to stay, is because I have seen the wide-ranging ripple effects on patients' lives. I have heard from patients who were seriously considering suicide as an option. They were suffering from trigeminal neuralgia pain, which have a new lease on life. How much did it change their life? How much did it change their interaction with their kids, their family, their grandkids? And in a similar way, when we talk about neuropathy, when we talk about diabetic or chemotherapy-induced neuropathy, it's a progressive disease. It's only going to get worse if we don't do something about it. And we've had so many patients' lives have been turned around because of class 4 laser therapy treatments, that now they can be pain-free and functional. So, so doctor, my why is that ability to use light. I mean, at the end of the day, that's what we're using is light. Laser is light. We're using light to improve people's quality of life. And that's a really big thing.
So, just different topics that seem almost like it's sci-fi. And we can be able to give you references and ability to be able to take a look and find the resources so you can do your own literature review. I don't want you to believe me. As a matter of fact, when I talk to my patients most of the time, I don't want you to take my word for it. You need to know it for yourself. So for those of you who say, you know what, I'm not so sure about that, good. let's be able to connect you with the resources so you can be able to see where the value is, where it has some degree of benefit, where it has some degree of loss, and how those things can be potentially useful to you. In this next topic, we're going to talk about neurofeedback and how that can be able to change kind of that mind-body connection, how when you're depressed and how when you're anxious, it really can be influential to your pain, and how we don't always have to be reliant upon drugs in order to be able to get some form of benefit.
And I was pretty depressed and upset and very worried all the time about the pain. And what I learned is that if you worry, you create physiology that makes things worse. And if you relax, you create physiology that actually makes pain go away. So within a day, just knowing I could have some control over it, because everybody was telling me, the other doctors were saying, we don't know, and it's not within your control, and this may just be it for you. As soon as I found that I could control it, there was something I could do, it just changed everything. And within a short time, I felt much better. I was able to go back to work. I was able to complete my degree. And I worked for a while for the state in an administrative job, but then I decided I was happiest when I was telling people about this. So I went and got training as a biofeedback practitioner, and initially just what they call peripheral measures, but which are, what I mentioned before, hand temperature, heart rate, muscle tension, respiration rate, things like that. Neurofeedback is much more complicated, but when I started to learn about that, it just looked like there was so much potential there that I got trained, and I've been doing biofeedback for about 27 years and neurofeedback for 23 or 24 years. So I've been able to really, work with it and help a lot of people with it.
Okay. So, question for you. You have provided a number of resources for individuals really to be able to kind of take and do their own due diligence and understand about some of the options that they have you not? Can you tell us a little bit? I think you've had both a website as well as a book. Do you mind talking about either of those two for us?
Sure, glad to. So I wrote a book a few years ago called The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. It is available on Amazon. And what that is it's, now this is about 5 years ago, so I looked at all of the available treatments, conventional and alternative, and looked at all of the research about whether they were effective or not. And no surprise to me, I discovered that a lot of the drugs weren't that effective, and a lot of the non-pharmaceutical treatments were very effective. So
Okay, and so as you heard, both biofeedback and neurofeedback can have their place in being able to help treat not only the aspect of pain, but the different sequelae and issues that are associated with it. One of the things that can be used is a pain journal. What we have is an automated app in our own practice that's called NeuroFlow that we utilize to help patients be able to see how their pain can ebb and flow with their anxiety and depression, how it may affect their sleep, and how it might affect their activities of daily living. And the two are not always just one way, meaning your pain always causes anxiety and depression. Sometimes your anxiety and depression may potentially potentiate and make your pain worse. And so what we need to do is to look at both sides of that coin, if you would, proverbially, and then find a way to be able to influence them both for the betterment of the person, right? So all of these individuals are individuals who've been doing this for decades. And our next video actually talks about this as well. It's Dr. Jonathan Fenton, who is one of the most well-known regenerative medicine specialists in the entire country. He's phenomenal. Prior to getting involved in regenerative medicine, actually I sought his clinic out when I left from Boston to go to their clinic in Vermont to be able to see them do some of the things that they do on a daily basis. And in this context of this video, he talks particularly about ankle, knee, and elbow, but specifically ankle type treatments and ankle treatments and how to be able to use regenerative medicine to be able to get the best potential relief you possibly can.
So with ankle injuries, the typical ankle sprain is where the lateral ligaments of the ankle, which is here, so the lateral ligaments are there and there and there. So the lateral ligaments of the ankle get stretched out or torn, and then the ankle sort of slides forward. And then there's a second part, which is there's a box formed by your tibia and your fibula. Backwards imaging on your computer. And so there's also a high ankle sprain, which is here, which is often not diagnosed and treated. So our job in regenerative medicine and in really well done diagnostic orthopedic medicine, and the surgeon should do it too, is to assess what parts are sprained, not just the main joint, but the high ankle sprain too, or the tib fib joint. And then the other joint is below it, between the ankle and the heel bone, the halocalcaneal joint. And then there's joints in the front of the foot. So it's really a complex of multiple bones. And so when you come to someone who's trained well, they motion test all those ligaments and joints to see what's stable and unstable, what's loose. And then the standard of care should be that at the time of your initial visit, even if an x-ray is done where there are no fractures, which is all x-rays really show, an ultrasound should be done to look at every single ligament and see what's torn, and then use ultrasound to stretch the ankle or move it in such a way so that you can stress the ankle, and the ligament shouldn't allow the bones to move much. And so if you stress the ankle under ultrasound and the joint opens up and gaps, then you know the ligament is not competent. And so that should be the standard of care on the initial visit. And unfortunately, in the United States, that is rare.
In that video, Dr. Fenton goes on to really explain his methodology of treating ankle using PRP, using stem cell type therapy. And those options aren't that common to most people. They think, you know what, I have to have a fusion of my ankle. And as we know, when we talk about dealing with ankle pathology, it affects the whole aspects of the leg and posterior chain. So once you have an ankle that causes you to have a problem, it'll affect your knee, it can potentially affect your hip, and potentially affect your back. And so although we don't think about ankle pathology all the time, you don't see it advertised on TV, you don't hear about people that, are constantly complaining about their ankle. That ankle is kind of, to use that proverbial kind of reference to Greek mythology, the Achilles heel, in terms of how a lot of things can be impacted. And unless you have a provider who's really assessing that piece, it can be something that's overlooked. In our next video, I had the chance to be able to talk to one of the most progressive CEOs of a company that is just really incredible. He's one of the most humble guys that I have had the pleasure to meet and talk to, but at the same time, his product is doing incredible things for people. It would be a disservice to someone who has a potential problem that his product can treat, not at the very least to go to the website and evaluate and see if it's a fit for you. Stay tuned as we talk about Enzo and we talk to Sean Rahimi a little bit more about what that product is and how that really can be impactful.
Utilization of that is pretty unique on how patients experience it. Can you tell us about all of these people that have said, you know what, this is new and this is different and it changes people's lives?
Thank you. Thank you for all the compliments.
Yeah, sure.
So I think I think what we have here is something that's very unique and that needs to be represented accordingly. And a lot of people say I have this waveform, I have this new treatment and pain management, and pain is so subjective. It's hard to really explain that without having some scientific data that supports the device, what you're doing, as well as results, just straight up results, from patients, from physicians that use it, and the traction from that. So we've tried to, as we have this high frequency competitive energy that is being delivered by the device, which is totally different from all the TENS, inferential, and more similar to how these implanted spinal cord stimulators in many cases work, just all pain. We wanted to make sure we could back those statements up, or the uniqueness of the product, with scientific data that shows not only how well the device works, but also how it works to an extent. And so far what we've done is developed both nerve ion channel study studies that show the device again delivers these nerve block-like effects, which is different from these other devices. We've also tried to work with partners that we know just, you can't buy, So like, you can't go to UCSF, the heads of the spine center there, and say, hey, can we give you $10,000 and get you to give me the data that I want, and so these academic institutions have been instrumental to our goal in communicating to the world, that we have something that is going to be good for patients, that is ethical, is credible, it's something that eventually can be inevitably what people should be doing to solve pain. And those partnerships came from just honest conversations with these guys where initially, especially before we had the data, I don't even know if it works, and so I think developing those conversations with those people, like you said, like, not to brag, I don't want to brag because then you say you're humble, you're actually not humble. But with humility and saying, I don't know where we're at, I want to work with you. And I think the value of those partnerships is really learning from these people that are in many cases super knowledgeable. Some of the best surgeons, like people that I'd send my mom to if I had pain, she had pain and for spine surgery or pain management reasons, and just getting their feedback on what does the product need to look like, what is the messaging that we're doing need to be as well, so we make sure that people are, if it works, understanding that and have an opportunity to access it. If it doesn't work, we're trusting that too, for certain patients, and explaining that accordingly. So.
Okay, so if it wasn't clear, that was the Enzo product, which is actually a non-invasive treatment. It's wireless. Many people would probably try to compare it to the aspect of a TENS unit, but trust me, it's no TENS unit. It's way more sophisticated than that. It has a lot of data behind it. It has a lot of researchers that are behind it, from Mass General, from aspect of Cornell, from I want to say Stanford and UCSF. And all of those researchers have been really looking at how can that provide value to patients in a non-invasive model, which mimics some of the things that we do with traditional invasive neuromodulation. So put into layman's terms, so you understand exactly what I'm saying, is can we use something like a TENS unit to maybe be able to get results like a spinal cord stimulator? That's what we're talking about. So one of the other products that we're going to talk about is the aspect of Qtenza. We're actually going to be having a guest speaker probably sometime early next year that can really be able to give some insight about it. But this particular talk was a talk that I gave looking at not only the videos that were present for what Qtenza is, but also some of the research data that looked at it and how and why it might be useful. So the context of this is that it's a patch that's applied to the affected area that normally has a neuropathic pain source, right? So neuropathic meaning it's a nerve pain type issue. Qtenza is efficacious and indicated from an FDA standpoint for two indications at present. The first is for postherpetic neuralgia. So what does that mean in English? It basically means for shingle type pain that exists afterwards, which frequently is present in the trunk, and most of the time we would give something like gabapentin, Neurontin, Lyrica, those type of medications, but they can have a whole host of different side effects and also not be as efficacious. But more importantly, well, probably equally as important, is it's also useful for diabetic peripheral neuropathy, right? So for those people that have that burning foot pain that's typically worse at night, it has both of those two indications. And the upside is not only is it more efficacious, it comes on faster in terms of how long it takes before it really starts to work compared to many pill formulations. And on top of all that, it also has less side effects because it's a topical application that's done in the physician's office, is done, and normally will give you sustainable relief for a number of months. So you're not having to do it over and over again. Take a quick look at this video and get some further insight about what Qtenza is and how there might be some value for you or someone you care about.
And then peel back a small section of the protective release liner. Place the adhesive side against the skin. Slowly peel back the liner while smoothing the patch against the skin. To ensure Qtenza maintains contact with the treatment area, a dressing such as rolled gauze may be used. When treating feet, Qtenza patches can be wrapped around the dorsal, lateral,
All right. So as we talk about Qtenza, we're going to give you more insight about some of the other indications that are coming down the path. But if you have that burning type pain, that shooting type pain, those things that give you problems and issues, it may be something for you to look into as a potential option. One of the other talks that I gave to our watchers and viewers was about low dose naltrexone. And so this actually, we have a number of patients within our practice that are actively using it. And we came across it by looking at some innovative things that other rheumatologists and pain physicians were doing. Take a quick look at this video and get some understanding about how it might be useful, particularly if you have joint pain, small joint pain, combined with sometimes large joint pain, and you're trying to be able to assess, do you use a potential biologic from rheumatology, do you use prednisone, do you use other potential steroids or other more potent pain medicines, and what you can be able to do with this really common treatment option that's pretty inexpensive but is not being touted by medical science all that much. Take a quick look.
So naltrexone itself was first synthesized in 1963. So without perturbing any of our audience and viewers, obviously that was a bit of a time ago, right? And using it in a low dose hasn't really been in vogue, particularly here in the States, or in aspects of the rest of the world until somewhat recently. So naltrexone has a number of different properties in the way that it acts and works, but the reason why we think that it may have value is there's a number of different reasons. First of which is non-narcotic. It's actually an opioid inhibitor. Traditional doses are somewhere around 50 to 100 milligrams, and it's used in the context of addiction within that context. But when we talk about low dose naltrexone, really what we're talking about is 1/10 of that standard dose. So 0.5 to 4.5 milligrams. So where does it seem to find value? It finds value in a couple different components. Is number one, is it mimics certain substances in the body that can cause endorphin release, as well as it has an immune response, so it is able to modulate the immune system. So in my
All right, we don't need to hear what that guy's talking about. So at the end of the day, as we can be able to get some understanding about it, is that there can be able to have value for patients being able to use a potential treatment option that has minimal side effects that really can be able to help improve joint pain in particular by using different processes in the body to help decrease pain without having to have a traditional opioid or other painkiller and some of the sequelae that are associated with it. And then kind of in summary of all our different topics that we've been talking about, we have another video that talks about endoscopic spine and what's the value in it and how there might be some utility in terms of its possible treatment options in lieu of traditional spine, assuming that it's a fit. Take a listen to Dr. Neil Coleman, who's one of the premier authorities in doing endoscopic spine, particularly within the areas of Indiana and central Indiana in particular.
Are there certain things that may be more suitable for endoscopic versus other things which might be more suitable for traditional spine?
Sure. I think
So to reiterate that, as I'm going to have him jump in and answer because it may not have been all that clear, was the question that I posed was, are there certain things that are better for endoscopic spine versus traditional spine? So let me be clear for those of you who may not have watched that full video, though you should. Endoscopic spine is going to be a minimally invasive approach, meaning you're not making a huge incision. You're making a small incision and then you're going through to see the area of interest with a small tube, kind of the similar size as like a McDonald's shake straw. That's what you're utilizing to get down there, change that tissue and get it back to where it needs to be if other more minimally invasive type treatments can't do the job and tray. So let's listen to what Dr. Coleman has to say and hear him out.
if somebody has many different levels where they're having nerve impingement or problems. I think traditional spine surgery to treat the multiple levels that one encountered fusion. Now, adjacent segment disease is the medical terminology for I've developed spinal stenosis above the level I was fused. Traditionally, you'd have to have a larger incision and have the lamina or the bone removed and the ligament taken out. And oftentimes, you have to have your fusion extended, which means the old hardware has to be removed, the new hardware placed, and medical screws placed in the segment that was decompressed and a longer rod placed. So you've lost more mobility. Almost all the time with the endoscopic procedure, we can go in and remove some of the bone and most of the ligament that's causing the spinal stenosis as an outpatient procedure with monitored anesthetic care or sedation, we would say, and relieve the stress on the nerves, improve the leg pain or relieve it completely, and allow somebody to stand up straighter and walk further without having to have a big incision or having to wrestle through their scar tissue or having much risk of extending their spinal fusion.
Okay, so this has been some of the highlights of our videos that we've had in 2020. Obviously, 2020 has been a very difficult year. It was a year where we really took our channel back for both Facebook as well as YouTube to act as a resource for individuals and patients. And we are really thankful and thoughtful about the different topics that we're trying to be able to present to patients and to viewers. What we really would hope for in 2021 is not only the ability to hopefully be able to impact people in a greater way than what we're doing right now, but also to be able to know those questions that you really want to have answers to. So those things that you are afraid to ask or you don't feel like talking to your doctor or your friends about because you just feel uncomfortable about it. We want to be able to be that pain resource and that regenerative medicine resource that you can say, I can come here and I can get answers. And we hope to be able to impact you as much as you've impacted us. So we look forward to talking to you in the new year. Happy holidays to everyone and be blessed. And remember, we're here to help you punch pain in the face and get back to leading the life that you deserve. Have a great day.